Hello, everyone. I'm Dr. Gerry Fishkin, and welcome to my show. The current date is June the 5th, 2025, and I'm coming to you from Southern California. But before we get into the content of today's show, I want to talk for a moment about my show itself, at least conceptually. 8 years ago, when we were developing my show, my producers and I thought to keep the show evergreen. And what does that mean? In the business, it means no date, no time, and no place, thereby providing for the total focus on the topic and content of my show. Because my show is content-driven. However, the importance of today's topic has forced me to abandon that format, at least for today's show. So today, we revisit a topic that has become more urgent with each passing year. Children in crisis, 5 years later. The world may have reopened since the COVID crisis, but for millions of children and adolescents, the lockdown never really ended. Not emotionally, not socially, and not developmentally. 3 months ago, March 2025, we celebrated the 5th anniversary of the draconian lockdowns associated with the COVID-19 virus pandemic. Today's episode is about the effects of that mandate on the lives of America's children and adolescents. This does not necessarily include states that did not lock down. 5 years ago, when COVID-19 forced the world into isolation, I said, quote, "We're living in a sick world," period, end quote. And in 2021, I did a podcast entitled, quote, "Healing a Very Sick World," period, end quote. Look it up because it relates to everything I'm going to talk about in this podcast today. One of my patients back then told me the world feels upside down. And now, half a decade later, we're still living with the psychological aftershocks, especially in the lives of our youngest and most vulnerable. Let's just call this what it is, a generational wound. Children in K-12 were pulled out of classrooms, locked behind screens, and then expected to adapt without the tools, support, or developmental readiness to do so. Back then, I treated a 15-year-old boy, an honors student who planned to go to medical school, and he described the lockdown as, quote, "amplifying effects on the mind that brought shame and sorrow, and that same sorrow lingers today." Another student said to me, "I wake up, log into school, and never leave my room. The stress and anxiety of school have multiplied. We're supposed to relax over break, but now we need the whole break," and he's talking about the spring break, "just to catch our breath," period, end quote. These weren't just one-off quotes. These were cries for help. I heard it every single day because every day for the entire period of COVID, I worked face-to-face in my office without a mask. I let folks, my patients, come in with or without a mask. Most of them did not want to wear a mask. And for 5 years, I worked with these people right through this pandemic, which is what allowed me to bring this material to you today. As I said, these weren't just one-offs. These were cries for help. And 5 years later, those cries continue as a result of the draconian measures invoked in the blind attempt to deal with a virus. We now know that children were the least susceptible to the COVID-19 virus. They were clearly the most affected longitudinally. We must also take a hard look at the media's role. During the height of the pandemic, media coverage, though well-intentioned, I guess, often leaned towards sensationalism. Terms like crisis, surge, death count were part of the daily language. Children overheard it all. One of my teen patients said bluntly, and this was a quote, "The media blew COVID up like it was the next Black Plague. It dismantled my will to keep going," period, end of quote. That's from an adolescent. Children internalize that fear. Many still carry it. The media, parents, and educators all must share responsibility in restoring safety, not just physical, but emotional. 5 years later, one of the starkest outcomes is chronic absenteeism. Jason Riley, writing in the Wall Street Journal, recently reported that in New York City alone, and New York was a lockdown state, absenteeism rose from 25% before the pandemic to nearly 35% today. That's just incredible. And shockingly, some state officials have removed absenteeism as a school quality measure. Why? Because the normalization of not showing up became a part of our culture during lockdown. When attendance became optional in a virtual world, the message was clear. School is negotiable. Now, it's not. Children who aren't present don't just fall behind. They vanish emotionally, socially, and educationally. The cost of isolation, a 334% increase in self-harm among 12 to 17-year-olds at the peak of the lockdown. And what about today? Even in reopened classrooms, children are relearning how to socialize. Anxiety, aggression, depression, and fear haven't disappeared. For some, the ability to trust and form relationships has eroded. For others, digital devices became their lifeline, now turned into a leash. Another lingering consequence of the lockdown, often overlooked, is the dramatic increase in escape behaviors. During the height of the pandemic, when routines dissolved and emotional support systems collapsed, many adolescents turned inward, while others turned to substances. Reports show significant spikes in teen alcohol use, drug experimentation, vaping, and even behavioral addictions, such as compulsive gambling, binge eating, and online pornography. These became coping mechanisms, ways to numb, distract, or disassociate from the pain of isolation, fear, and uncertainty. Let's be clear. These behaviors aren't just habits or one-offs. They're cries for relief. I treated teens who admitted they drank daily just to feel something. Others used marijuana to ease their anxiety before logging into Zoom class. Still others got so caught in online gaming that reality became optional. The fallout? Dependency, stunted emotional growth, academic disengagement, and in the worst cases, spiraling into mental health crises that left families shattered. And if we don't address these behaviors now with compassion, awareness, and professional support, they may become lifelong struggles. Prevention begins with understanding how these behaviors took root in the first place. Unprocessed trauma, unmet emotional needs, the absence of real human connection. These were major factors. And let's not just diagnose the problem. I have 9 actionable steps for parents, teachers, caregivers, or anyone who just wants to listen and learn. Number 1, listen and validate. Your child's fears are real. Don't dismiss or downplay them. Don't pretend they don't exist. Number 2, seek professional help. Therapists can make all the difference in the world. They can provide an outlet for the child to communicate. Number 3, foster open communication. Model emotional honesty. It teaches emotional literacy, as I like to call it. Number 4, create daily routines. Predictability brings comfort. And it's those routines that help get us out of the trauma phase and into a life phase. So daily routines, healthy routines are really, really good. Number 5, encourage physical activity. Movement improves mood and energy. It builds dopamine and serotonin. So obviously, I encourage workouts, physical activity, walks, anything that gets us out of the house and out of our head. Very important. Number 6, limit screen time. Shift focus to real-world experiences. If you look at some of my early podcasts, I talk about the insidious effect of our cell phones and our digital processes, our digital toys, and how they shift us from reality to some fantasy. We need to come back into reality. So limit screen time. It's really, really important. Number 7, promote coping skills. Teach journaling, breathing. Techniques such as mindfulness also helps to clear the gunnels and restore healthy thinking. Number 8, rebuild social skills. Organize real-life interaction and let kids reconnect. It's very important to understand that children learn emotion from watching faces and watching emotion. They can't learn emotion if you're wearing a mask. And so that modeling process for many children during this COVID freak-out pandemic has affected children in so many ways. It's important for them to interact. It is important for them to share themselves with other kids, especially their age mates. And number 9, stay hopeful. Model resilience, and hope is contagious. So if you model and stay hopeful, you present a model for children to get out of their internal misery, to say, hey, there is something else behind or beyond what I am feeling. And here's something else, folks. Stop catastrophizing. Get present. Stay grounded. Stay in the moment. If you're a parent, your child watches you. If you're anxious and fearful, they will be anxious and fearful too. Remember, we are the healthy models. We must be the healthy models for the children. Organizations like teenline.org, and we're putting that up on the screen, offers teens a chance to talk to other teens, peer-to-peer support that's often more effective than anything an adult can offer. And if the situation is urgent, don't hesitate to call the National Suicide Prevention Lifeline. It's 988 on your cell, and we'll put that up on the screen as well. Let's remove the shame and silence around seeking help. This is not about blame. This is about responsibility. And it's also about compassion. As I write in my book, The Science of Shame, compassion is the combination of empathy and attunement. We must be empathic to the needs of these children that have suffered so much. And we must stay attuned to where they are without making judgments or having unrealistic expectations. The past 5 years revealed just how fragile and how strong our children can be. but they can't do it alone. Resilience needs help. As adults, our job is not only to protect them, but to equip them, to help them heal, to help them grow, and believe that the future holds something better. We must always remind them, you're not broken, you're healing. I'm Dr. Gerry Fishkin. Thank you for listening. Stay safe, stay grounded, and let's continue doing the hard work and the beautiful work of protecting our children's futures. If you enjoyed today's episode, don't forget to like, subscribe, and share it. I'd love to hear your stories. Hit me up at Dr. Gerry at drgerryfishkin.com and follow me on social media. Until next time, I'm Dr. Gerry Fishkin wishing you good health and happiness. And thank you for joining me on this journey today.